Welcome to a podcast brought to you by the American Academy of Orthopedic Manual Physical Therapists. Our academy is a national organization committed to excellence in orthopedic manual physical therapy practice, education, and research, and we're here to explore a wide range of topics with you through interviews with content experts.
Hello, my name is Stephen Schaefer, and it's my honor to introduce our AMP podcast audience to our newest co-host, Dr. Antigone Vesey. Antigone, welcome to the podcast. How are you doing?
I'm doing great. Thank you so much.
Well, we are super excited to have you on board as part of our podcast team. With the addition of you, it makes us a crew of 5. And let's start by introducing you to our audience. Can you tell us a little bit about yourself?
I'd be happy to. I am an athletic trainer and physical therapist. I'm a sports certified specialist and fellow of the Academy. I currently own my own practice called AV Performance Therapy, but I also enjoy teaching at the DPT level and mentoring at the fellowship level. My main patient population is the complex aging athlete, but I also enjoy teaching and speaking to tactical athletes, which I speak to all across the country on injury risk reduction and pain science education. I really believe these individuals are underserved, and they are the ones that serve us. So it's an opportunity for me to serve those who serve. So I do that on the side as well.
That all sounds great, and there's no doubt in my mind that your areas of expertise are going to bring to the podcast a wealth of knowledge and experience that's just going to help us make a better product as we move forward. As for things on this end, it's been a little while since I've talked directly to the audience about the world that I live in, and I happen to still be practicing in Ontario, Canada, so I am a full-time clinician. In addition to that, I have my hands involved in a handful of different research studies. I think that's about 3 to 5 different projects now, depending on how that, let's say, unfolds moving forward. And the newest thing in my life is that I'm now a certified Pilates instructor, which is an avenue of clinical experience that I never anticipated I would endeavor down, but it's turning out well thus far, and I'm excited about that. Speaking of excitement, I'd like to ask you, what has you excited about joining the podcast team?
I was so excited to join this team. One, I've really found a lot of personal and professional growth by actively listening to people who think differently than me or have different experience than I do. And I felt the podcast would be a way for me to seek that opportunity often and intentionally, and a way to put myself in front of people that I can grow from while also having the opportunity to serve the profession in some capacity.
There is no doubt in my mind that you're going to serve the profession well and that you're going to help out tremendously here at the podcast. As I've already said, we are stoked to have you on board, and I think this is going to be a phenomenal experience for all of us. Speaking of which, we are just about to come to the end of our 2020 conference interview series. I do believe we have 3 remaining episodes left. 2 of those will be from you, and then the final one is an episode that I recorded. After that, we'll get back to our regularly scheduled and themed interviews, which means we'll dive back into individual research studies, which, as always, should be a lot of fun. Speaking of which, if I could just take a moment and mention to our audience again, if you love the show, if you find it educational, please reach out and give us a 5-star rating. Whatever platform you use, if you rate us, it helps people find the podcast. And also feel free to share us with your friends, your colleagues, your students, with anybody that you think would enjoy the AMPT podcast. All of that having been said, I think that was a brief but great introduction. So once again, Antigone, welcome to the podcast team. I think our audience is going to benefit greatly from having you on board with us.
Thank you so much, Stephen.
Thank you, and let's get to the interview.
Hello, my name is Antigone Vesey, and today I'm honored to have the privilege of introducing Dr. Brian Pickens to the podcast. Dr. Pickens is currently an associate professor and the program director for the U.S. Army Baylor Doctoral Fellowship in San Antonio, Texas. He has been assigned to multiple Army installations, providing direct access outpatient care, as well as being tasked with reducing injury rates and optimizing military readiness. His research and teaching interests include clinical mentorship and decision-making, which is the topic we will be discussing today. I had the pleasure of hearing him and his colleagues speak at AAMP this year. The presentation was titled Coaching, Mentoring, and Sponsoring, Professional Development in Physical Therapy Practice and Education. As fellows, we've experienced the impact mentorship has had on our clinical practice and professional development. I look forward to providing Dr. Pickens a platform with which he can expand upon this topic. Hi, Brian. Thank you so much for joining us on the podcast.
Hello, Antigone. Thanks for having me. I'm really looking forward to it. Let me start by recognizing Dr. Chris Allen and Dr. John Umloff, who were my co-presenters for this presentation at AAMP and did a fair bit of the work that went into this talk.
You clearly described the different relationships between a coach, a mentor, and a sponsor. I was wondering if you could define these again for our listeners, and then tell us what inspired you to propose this presentation for AAMP.
Yeah, happy to do that. First of all, I think the thing that we need to kind of talk about is that mentorship and coaching and sponsoring, there's a lot of different definitions for those out there. I'm going to come at this from a way that really kind of separates them, though they likely all kind of interweave and are really happening regularly at the same time. But as we try to separate those a little bit, we talk about a coach being someone who teaches someone how to do something. A coach talks to you. They're going to be talking to you about how to improve at a certain thing, and they're going to give you specific feedback about that particular skill or item that you're trying to improve. To contrast that, a mentor is really going to show you what it takes and helps you find your way. So the word kind of associate with mentor is this person who's maybe going to be your guide. The mentor, as you're going through this kind of a learning and development process, they're going to be someone who's going to talk with you. They're the person that helps you decide exactly what it is you're trying to learn or how you're trying to develop. And they're going to talk to you about why you want to maybe do that thing, and then maybe making meaning of that development as you go. Finally, the sponsor is really someone who's going to tell others about you and what you've accomplished and maybe some of the things that you're capable of and your aptitude. And they're also going to be someone who tries to pull you along or to promote you into a position that you might not otherwise have thought of for yourself or maybe even had the opportunity to get into. And how I came about this was as I was kind of moving into this position of a fellowship director, I had the opportunity to go to a faculty development course. And one of the topics that they discussed was coaching, mentoring, and sponsoring. And as I listened to that talk, they were defining these things that I had received as a fellow. And I didn't necessarily know what those were, or I maybe hadn't given them labels. I was coached on how to do certain techniques and how to communicate with patients. I was mentored through the whole process of developing as a clinician. And then I was sponsored into some different positions and maybe onto some different committees through my time as a fellow. And I didn't really have labels for that, and I didn't know how to do them well. That's really kind of where I got the inspiration for talking about these things and maybe separating them a little bit so that we can think about doing each of those and being intentional as we coach, mentor, and sponsor the next generation or even PTs in our generation.
I completely agree with that. When I heard your presentation, those role delineations was something I had never thought about. And like you said, giving it a name made me reflect on my own practice and these individuals that coached me into having different skills, who truly mentored me and brought me into a different place in my clinical practice, and then who sponsored me now moving forward into different roles in my professional career.
Yeah, it's really good that you kind of mentioned that about people that you've thought back on, because I think at times we think about these people and we have this idea that they need to be all of those things, coach, mentor, and sponsor. And there's likely some people that really could do a great job of coaching you, but don't necessarily make good mentors. Or maybe they're mentors that develop into sponsors, but they're not fantastic coaches. And so I think that that role delineation and for us to understand that not only as someone who might be taking those roles, but as someone who's looking for someone to fill those roles in our own professional development is probably important.
As the director of a fellowship program, you probably are doing all of these roles. Which role do you enjoy most and why?
Yeah, that's a fantastic question. I think it's really hard to answer. I do find myself doing all three of those, putting on different hats at different times. And sitting across the table from someone as their mentor, it looks a lot different than when I'm in the clinic with them, giving them coaching on a technique. I would say that the role that I enjoy the most is likely that role of mentor as you kind of work with someone through the process of developing through their fellowship. And as they start making connections between material and between the material and patients that they see, I really enjoy being the guide through that. And then I would say that it's been really cool to then have some of those relationships that were mentoring relationships turn into sponsoring relationships, where as you see someone that has some particular skills, whether that be maybe in research or in teaching, to be able to promote them into some opportunities and say, hey, have you thought about this? Or maybe you should give this person a call. I think they're looking for someone with your skill set, and I think you would match pretty well with them. So I know I ended up saying all three, but really it's probably that mentor piece and then the opportunity to sponsor a little bit as that relationship grows that I've liked the most.
As a mentor myself, I would have to agree with you. It's really fun to watch someone else grow and know that you had a piece of that process. But then also, it holds you accountable to your own practice. And so you get better in the relationship, and it's a really rewarding experience for both parties. That's why we've sought out fellowship and why we continue to engage with it. What do you think sets the foundation for a good mentor-mentee relationship?
I think there's so many things that we could probably get into there, but it's likely communication and trust. From a communication standpoint, I think it's really this mentor mentee relationship needs to be one where it's mentee focused. That mentee is coming to the mentor with some goals and a plan for kind of how they want to be mentored and where they want to go with this time that the mentor and mentee are going to spend together. Setting expectations and communicating very clearly the goals and where they want to go with this relationship is probably the most important thing. And then the second thing being trust, and that is that the mentee and the mentor both feel heard in their expectations for what they're going to do, the time they're going to spend together, but then that the mentor is looking out for the mentee's best interest. And also that the mentor is not going to be misused or kind of be, I don't know how to best say this.
Taken advantage of.
Yeah, maybe, yeah, exactly. I think it's taken advantage of. And so I think if the mentor feels like they're being taken advantage of in this situation, obviously that's not a great relationship.
That's a great answer. In your presentation, you highlighted something that I thought was really pertinent that a lot of us who are probably listening to this podcast that do mentor individuals, I think, should hear. And that was evaluation and feedback were distinctly different. Can you expand upon this concept?
Yes. Evaluation and feedback are likely things that we blur the lines between regularly. And as learners receive both of those, they likely respond differently. If I'm giving a clinician feedback on their performance in a given day, it should be something that they can build on, right? So I should be giving constructive feedback and ways that they can get better, as opposed to evaluation being this almost end of day or even end of course thing where it's this is how you did. And what the learner ends up hearing is this is how you did, hard stop. They process that as, well, that's where I'm at, and not necessarily a where can I be going. That's really kind of the difference between evaluation and feedback there that I think we need to think about is how do I make sure that when I sit down and talk to somebody at the end of a session, that I'm giving them feedback and giving them the opportunity to maybe even respond to that and have a discussion, as opposed to an evaluation where I'm saying, well, that was an 85 and marking everything up in a red pen. That's kind of probably what I would say is important that we make that distinction, because otherwise, if we are too often evaluating, we don't give that learner the opportunity to grow.
It does seem like evaluation doesn't have room for growth the way that feedback does. Feedback's a little more constructive. There's an opportunity, there's a path there where if you're only providing evaluation, that might lead to that relationship breaking down.
Right. And I think it's important that we do say that there's evaluation happening before feedback. And so that person who's doing the observation has to make an assessment on where the learner is, but then they need to present that information in either an evaluative kind of final type method or as feedback, which promotes growth.
We often talk about these responsibilities of the mentor, but what about the mentee? What actions do you think they could take to improve their own personal growth and benefit more out of that relationship?
It likely goes back to something that we talked about a little bit earlier. And I think that that's clear communication of what the mentee desires from the relationship. Likely too often in these mentor-mentee relationships, the mentee could come to the mentor going, "Hey, would you mentor me?" without really a clear way ahead and a clear goal in mind. I think it's imperative that if that happens, that the mentor would then ask, okay, what exactly is it that you're looking for? And what is the goal of these meetings? If you're just looking to come in and glean information and listen to a mentor talk to you or talk at you for a long time and give you the meaning of life, that's probably not the right way to go about it as a mentee. But seeking out a mentor for a particular reason and having specific goals in mind as to where you want to go is probably the most important part that a mentee can come into that relationship with. And it's probably important that you're choosing the right mentor for each of those things. You might have a clinical mentor that's different than the mentor that you have if you want to start going down a clinical research pathway. Those mentors probably aren't one and the same. It's likely important or imperative for that mentee to select the right mentor as well.
I would agree with that. I think oftentimes I get clinicians reaching out who say, "Hey, can I come shadow and observe you?" Or "Can I come chat with you?" And my response is always, "Well, what do you want to learn? Why do you want to seek this out?" Because then it allows me as the mentor the opportunity to make sure that I can put you in a successful position. Just coming in and watching or observing is probably not the best use of either of our time.
Yeah, that's a really great point. So that gets into maybe a different topic, and that's a little bit of this idea of role modeling. And when someone's observing, having an idea of what is it that you're looking to observe. I'm going to role model for you today these skills. And this is what you could glean from our time together. But again, that needs to be mentee driven, not necessarily that mentor saying, here's what I'm going to show you today. We'd like for those mentees to kind of take control of that and really guide the process and say, this is what I'm really thinking I need for my own development. And can we focus on this today?
I think it's worth reiterating that point of finding different mentors for different things and not expecting one person to be your role model or your one and only mentor. I think there's so many aspects of clinical practice that we could be growing in, and to really embrace those different relationships, because as you alluded to in the beginning, those ultimately become what are our sponsors and the people that bring us to the places that we want to go. I know that many of my mentors personally have become my sponsors. Can you talk a little bit more about sponsorship and the value of having this kind of relationship?
Yeah, I think sponsoring was the thing that really jumped out the most as we go back and think about the thing that made me think more about this talk and desire to dive into this a little bit more. I didn't realize maybe that I had been sponsored until there was kind of a name given to it. That was really something that was interesting to me. And I don't know if it's something that we talk about formally enough. we tend to have this kind of idea, and maybe it's just physical therapists or maybe it's professionals in general, that we take on more and more things. And if you're good at managing this one thing, you're likely decent at managing this other thing. And you tend to have a lot of plates that you're juggling, where we'd likely be better off if we find that person we've mentored and we give them an opportunity and we share with them something that maybe we've come onto or been excited about and know that they share that passion. That's where I think that we could probably improve in our ability to maybe step back and look around and say, not only when something comes up, should we maybe say, no, that doesn't fit for me right now because of my schedule or something else. But you know what? I think I have a person for you. That's really where I think that I'm trying to develop as a sponsor and trying to get better at that, and really kind of looking around and knowing the strengths of the people I've worked with and the strengths of maybe the organization and how folks could develop, whether that be into maybe an assignment that kind of stretches them a little bit or maybe kind of broadens their horizons or gives them a little bit of a peek into something that they wouldn't have otherwise been able to see.
That's a great point, that sometimes the individuals that lend themselves to being mentors are the ones that often want to fill those seats. But it really is our responsibility to become sponsors and to embrace that role of sponsorship and bring others along with us so that, one, we are not overwhelmed and we can live up to that mentorship expectation that we have, but also so that we can bring those around us into those roles and watch them shine. That's part of the joy of being a mentor.
Yeah, I love that idea of joy of being a mentor. And that's not only, getting to see the success of people that you've mentored and that you've had the opportunity to work with, but really being in that process and knowing that out the other end of this comes development and it comes growth, and then getting to see, like you mentioned, the fruits of that as someone steps into a role that they've kind of been yearning for and that they're maybe matched really well to.
It was interesting during your talk. I was thinking about sponsorship because I had not had it defined to me this way. But this is actually my premiere podcast with AAMPT. And I was thinking how I got into this role was actually through my fellowship. So Stephen Schaefer, who is the lead of the AAMPT podcast, he went to UIC and did his fellowship there as well. And I had the opportunity to meet him through an alumni event. It allowed me the opportunity to connect with this individual who brought me into this podcast, which is something I've always been interested in doing, and also allows me to speak with clinicians like yourself that helps expand my practice and my network. This was an individual to me that wasn't actually a mentor, but he was a sponsor. And when we think about these roles, I know we often think about the transition, but oftentimes we do have individuals that could uniquely be just a coach or just a mentor or just a sponsor. So it was really interesting to me to have that discovery during your talk.
Yeah, that's really cool. And thanks for sharing that story. I think it's probably not unique to you that there is somebody that wasn't a mentor that had the opportunity to sponsor you. And I even think that at times people kind of think about mentors or sponsors have to be 1, 2, or 3 steps ahead of you, whether that be in the corporate world or whether that be as a PT business owner or whatever. And really, it's likely that peers should be mentoring one another because there are likely people that you could look around that are your peers that are a little bit further ahead of you, like you mentioned, in doing a podcast. But you might have something to offer them from a clinic management standpoint or even best business practices. And so I really think that there's a lot of room for us to network, as you mentioned, and to really kind of draw on the strengths of the people around us, and not only maybe draw on those strengths, but recognize them and invite people in to use those strengths. And so I think that's a really cool story of someone who was willing to say, hey, I think you'd be great for this. And I really appreciate what you're doing and being on here with you today.
The other thing you said that I hadn't thought about till you put it into words was that the role of sponsorship has this risk associated with it because you are now recommending someone. And if that individual doesn't live up to whatever expectation you might be recommending them for, it's going to reflect back onto you. It made me a little bit grateful for my sponsors to realize that these individuals put themselves on the line to hold me up and allow me to shine. And I think that that's something important for the mentee to know, that someone is taking a chance on them and it will ultimately reflect on them, but also something for the sponsors to be aware of and be appreciative of.
That likely goes back to the idea of it's probably more often that a sponsor has had a relationship with that person that they're going to recommend for a job, especially if that's maybe within their own company or within maybe a small organization where they know it's going to reflect on them. I think that fits in most situations, but it also gives the opportunity for these proteges to really be motivated and also kind of proud to know that they were sponsored. Getting that opportunity or knowing that someone recommended you for that position should be hopefully motivating and likely empowering, because someone saw fit to recommend you for something and saw something in you maybe that you didn't see in yourself. And that almost brings up another bit of sponsorship, and that's that sometimes sponsorship can maybe stretch us in ways that we weren't necessarily thinking that we would go into, or maybe into opportunities and into broadening our horizons a bit in a way that we maybe weren't thinking we were going to head with our career. And maybe we'd gotten down a certain path, but someone just saw something in that protege and said, you know what, I think you would maybe fit well here. Maybe give it a shot. That can be empowering for that protege.
I love that. I think that's why we have embraced fellowship and why we feel so connected with other fellows, because we know this is a group of people that have developed their careers, are really passionate about the profession, and are continuing to expand their network and sponsor other individuals. And it's an endless circle of these different roles.
Absolutely.
So, what I always like to think about when we're going to end a podcast is your next step with this information or this topic. Do you have any future plans of presenting on this, or ways in which this information has impacted you that you want to change within your own fellowship program? What can we expect from you next?
Great question. I can say that it's something that we've definitely promoted within the fellowship, and we've done that in a couple of different ways. And one of those is to give our fellows the opportunity to meet people and to hear from people that could be mentors or could be sponsors. We're a military program. We bring in senior officers. We call it kind of like the view from their foxhole. And this is where they kind of tell their story and then talk about either a leadership thing or have a clinical discussion. But I think the other thing that we're looking to do is make sure that our fellows are connecting with people outside of just kind of the walls of our fellowship. Because sometimes we can be a little bit too close to what's going on in the fellowship. I'm maybe wearing that hat of coach, then trying to wear the hat of mentor and the hat of sponsor. And maybe I'm not doing a great job of doing all three of those. And so we really try to promote them reaching out to some other people around the area or in maybe a specialty that they think that they would like to head toward, and reach out and try to engage in that way. I've given this talk to the fellows that we're currently training, and I think that was well received.
It definitely gives a platform with which you could communicate your expectations, which, as you mentioned, is really important for that mentor-mentee relationship. I love the idea and notion of branching out to get different individuals involved, because essentially you're getting all of the benefits of their network as well. And like you said, their sponsorship may take you to a place that you weren't anticipating going initially.
Right. Yeah. We've probably tried to be a little bit more diligent with this kind of idea of, professional identity formation and really kind of giving our fellows the opportunity to see the profession and see other fellows and have the opportunity to engage with other folks outside of the confines of this fellowship. And hopefully that gives them the opportunity to grow and know that they can kind of grow into multiple different paths, whether that be academia or clinical practice or even clinical management, or in the military, more of kind of a leadership track, knowing that there's opportunities to engage people, whether that be through AOMPT or through other organizations, and that they can then grow in that way, I think has been kind of enriching for our students.
Brian, thank you so much for your time and for being a leader in delivering this message. Our listeners are going to get what I got out of it, which is just understanding these different roles, really reflecting on when we are in these roles and why, and how we're transitioning between them. It will enhance our abilities to mentor others. So thank you again for being a part of the podcast.
Yeah, I really appreciate the time to talk with you today. Thank you so much.
This has been a production of the American Academy of Orthopedic Manual Physical Therapists. You can learn more about the Academy by visiting our website at aaompt.org. You can also find us on Facebook, Twitter, and Instagram by searching for our acronym, AAOMPT. The views and opinions expressed on the AOMPT podcast are those of the interviewers and interviewees and do not represent the official position of AOMPT. The information presented should not be used as personal healthcare or clinical practice advice. If you need to find an expert orthopedic physical therapist near you, then check out the Find a Fellow feature under the Public Resources tab at www.aaompt.org, which you can find in the show notes.